This is Nadisha in Chicago, and you're watching my channel, Knowledge for Quality of Life. Friends, today I wanted to do something else, as I mentioned in my last vlog, but recently I came across a newsletter which I received it, and I have mentioned this biomarker a while back when I shared a list of variety of tests which I do. And I thought that, I should bring it out to my friends, families, and viewers so that, they can look at this biomarker as quality of life indicator as well. And I'm going to be sharing that some information with you today. Now, before I get into this, I wanted to say a few things to all my viewers, all my newly joined subscribers, that when you look at my vlogs, take your time, because sometimes, I miss my weekly vlog and due to my personal reasons, or sometimes I want to give you a time so that you all can digest the material which I'm sharing. And I'm hoping that you guys are looking at each vlog so that you can understand each piece of the puzzle which we are talking about as overall health for quality of life. Because I have observed, and while talking to few in my community as well, that people look at bits and pieces here and there, and they try to fix one thing, they try to monitor one thing, and they miss the other things. So when you look at overall health, look at it in total entirety of thing, because if you are missing few things here and there, and then you will miss the boat. So each and every element which I share here, look at it, take your time at your pace, because learning is not something that we have to finish in a day or so. It's ongoing thing as far as the improvement is concerned. So I would request all of you to participate in putting the comments, questions. If you don't understand anything, I do my best to address the questions in the comment section. People who have received the comments, they can vouch for it. And take your time, because if you want to learn, that's the bottom line. If you want to learn something, you have to give some sacrifice. And here the sacrifice is only the time, because the amount of time you invest in the knowledge, in learning, trust me that dividends will be paid out to you in not years to come, but generations to come. Because this is an investment. Time is an investment which you can do the best thing. So let me share my screen. Today's topic is, I want to talk about, as I said, biomarker homocysteine. So let me share my screen, and don't try to take the notes. I'm going to share the entire newsletter in the description, so you can have it. You can digest it at your own pace. You can read it. I'm going to share the link in my description, so don't worry about it. So damaging effect of high homocysteine, what to do about it and how to prevent it. So some key points here. High homocysteine is associated with an increased risk of over 100 diseases, 100 diseases, directly or indirectly, including accelerated brain shrinkage. Some experts consider this marker more important than to know your weight, glucose, cholesterol, iron, and many other markers, especially if you intend to become pregnant or are over 40 years of age, or have any memory, mental health, neurological, or cardiovascular concern. Homocysteine goes up when methylation is impaired. So basically, homocysteine is nothing but when you go down here, it's a toxic amino acid which body produces, and there's a methylation takes place in the presence of B vitamins to convert these toxic acids into various markers, which is beneficial to our overall health. So when one of the things are compromised, particularly the B vitamins, and we'll look at it furthermore, that what are the other factors which can impede this methylation process. So homocysteine goes up when methylation is impaired, indicating greater need for B vitamins. Now, this is very important for my folks, friends and viewers who are vegetarians, because they need to make sure that they are optimum in B vitamins. When I say B vitamins, means I'm talking about B complex, B1, B3, B5, B6, B9, B12, all the Bs. Particularly B12, especially vitamins in B6 and B12 and folate. But supplementing with folates and B vitamins alone has not always demonstrated benefit for lowering homocysteine levels and CVD risk, cardiovascular disease risk, indicating need for other factors such as vitamin D and omega-3. So I've been saying this thing all along, that one thing is not going to fix everything. So when we talk about nutrients, minerals, vitamins, we have to make sure that we are optimum or to the close to the optimum in various vitamins, nutrients, and minerals. And we talked about for omega-3 and vitamin D quite a bit. And B6, B9, which is folate, B12, vitamin D, omega-3 are major contributors of high homocysteine levels. So any one of these, the totality of these things, if we are compromising any of these levels, then it's going to elevate our homocysteine levels, and that could be a hidden factors, for our risk. And there are other hidden factors might be involved and must be addressed, which I'm going to illustrate in down the line. So homocysteine, as I said, it's a toxic amino acid produced by body during metabolism of methylation. Normally, homocysteine is recycled and converted into beneficial substances, a process that can be hindered due to suboptimal B vitamin status and other factors as described below. Now, some experts say that this is a crucial a biomarker. So normally this biomarker is not part of the standard blood work panel, which we go for our blood work annually. You have to ask your physician. You have to ask your primary care doctor that this homocysteine level needs to be checked, particularly if you are concerned with overall health. And sometimes I will say that sometimes you get pushback from the primary care physician or doctors. So you have to know your stuff before you go to ask something. So make sure that one of my prime objective is here to educate the viewers so they know some basics, so that they can have a better conversation with their primary care doctor that why you need it. You are not doing this biomarker test just for the heck of it, but there's a rationale behind it. So make sure that you do your homework. That's the most important thing. Otherwise, you will get a pushback from your primary care doctor. What is a good homocysteine level? So anything 7 micromoles per liter or less is considered optimal. Supplementation of B vitamins along with the additional interventions outlined below are recommended with levels above 10 micromole per liter. So if things are above 10 micromoles, then it's a point of a concern. So you have to work with your doctors to bring it down. Make sure that all the factors which are impacting your homocysteine levels are not compromised at certain point. And if they are, then you need to address so that your homocysteine can fall below 7 or within 10. Health effects of high homocysteine. What can things go wrong? Homocysteine is a biomarker for over 100 diseases, as we mentioned earlier, according to a published research. Homocysteine level above 11 micromole per liter is associated with accelerated brain shrinkage. So it plays a very vital role in neurodegeneration of the issues. In those with cardiovascular disease, particularly if it runs in the family, having homocysteine levels above 20 micromoles per liter increases the risk of death by almost 5 times. Every 5-point increase increases the risk by third. So this is a very, very important biomarker. A recent report of almost 3,000 cardiovascular patients found that the risk of death was almost 3 times higher for those with homocysteine levels of 15.6 micromole per liter compared with those with levels below 9.8 micromoles per liter. So you see that higher there's a strong correlation that the higher the homocysteine levels in our blood serum, the greater the risk. And we have to mitigate those risks by lowering it down. Now, elevated level is also a red flag for health issues such as vascular damage. High homocysteine can harm blood vessels, increasing risk for heart attack, stroke, or blood clots. Decreased brain and cognitive health, it's linked to brain atrophy, dementia, Alzheimer's risk, depression. Inflammation, it contributes to chronic inflammation, worsening conditions such as diabetes, osteoporosis, autoimmune diseases. So why measuring your homocysteine level important? So homocysteine level is often used as a measure of methylation, as I said, because of the B vitamins, and homocysteine level goes up when this methylation process in conjunction with the B vitamins gets compromised. Okay, if it's impaired, then this toxic level of homocysteine is going to go higher in the blood, and that needs to be controlled. Indicating greater need for B vitamins, especially B6, B12, and folate. Increased homocysteine levels can also due to poor absorption of vitamin B12. Now, this is there is a defect. They call it MTHFR. There is a genetic some variations with some folks which has a tendency of less absorption of B12, B vitamins. So you need to work with your doctor if you have this MTHFR genetic variant, which needs to be tested. If somehow your B vitamins are not going up, you must get tested for that genetic variation and address the mitigation parameters along with your doctor. And your doctor is going to address that. But the point I'm trying to make here in this vlog that homocysteine is a very, very important biomarker, and the elements which are associated with it are B vitamins, vitamin D. I have said enough about vitamin D over the course of time. It needs to be optimized, and your omega-3s as well. Particularly for my vegetarian friends who are not eating any animal products, particularly fish, because omega-3s are loaded in fish. Sometimes they rely on flax seed or chia seed for omega-3. But let me tell you one thing, that those omega-3s are in ALA form. The body gets converted, normally converts in ALA into EPA and DHA, and the body is not very much that optimum in conversion factor, from ALA to EPA and DHA. Normally 5 to 10% gets converted, and if it's not converted, you are taking it in the form of chia and flax, but you are not going to get enough omega-3. And the only way you can test is run a blood test of omega-3 and omega-6 and make sure that the ratios are not out of the whack. Because if the ratio is out of the whack, omega-6 are considered more inflammatory than omega-3s. So you need to increase omega-3 and reduce your omega-6s. How do you reduce omega-6s? By reducing or eliminating the seed oils and all the inflammatory stuff which we consume in our food. So low vitamin D levels can increase homocysteine levels as well. So that's what I said. You have to make sure that you are optimum range, preferably around 60, or above, because it's going to protect you not from the homocysteine perspective, but a variety of other diseases, other non-communicable diseases, which we talked about over the course of time. Getting higher amounts of omega-3 can lower homocysteine levels as well. So there was a study conducted, randomized controlled trial with B12 and omega-3 fish oil supplemented, and over the course of 8 weeks, if you see this data, it speaks for itself, So change in homocysteine levels. So when they had a 3-group basically. So green is a baseline, and changes. The blue is changes after the 8 weeks, means about 2 months. So in one case they use only B12. In one case they use only fish oil, and in the third case they use the B12 and the fish oil combined. So if you see that, from the baseline, the changes, the homocysteine level dropped by 22%. And in the fish oil category, it dropped by 19%. So homocysteine level came down lower by 19%. And in the third case, where they used the B12 and fish oil, it dropped by 39%. So homocysteine level. So it's very, very much proven by the randomized controlled trial and documented research over the time. Lowering homocysteine was also shown to reduce the brain shrinkage by up to 73% in those with adequate levels of omega-3 fatty acids. Because remember that what I said when I did the vlog on omega-3, that our brain is nothing but a blob of a fat. It needs to thrive on omega-3s and phospholipids. So basically oily fish is the best way to go rather than supplementing. I eat wild-caught salmon sockeye twice a week religiously, and I have 1,000 milligrams of krill oil, which I supplement along with it. And your omega-3 should be between 8 to 12%. That's the range one should have in the blood. And make sure that you verify that by testing. Other causes of high homocysteine besides nutrition deficiencies. Now, as I mentioned, that MTHFR mutation is an issue. So make sure that you don't have that kind of a genetic variation if you are not absorbing, or if you have a deficiency in the B12, even though you are taking the B vitamins and you are not absorbing enough, then make sure that you talk to your doctor about this MTHFR. This is an acronym, and you can look it up. It's a very complicated full name, and you can Google it, and you'll be able to see it. People with MTHFR variant may need methylation forms of B vitamins, especially type of B vitamins. You cannot have any type of B vitamins, and that's why I said that you need to talk to your doctor, that if you carry this variant MTHFR, then your doctor should help you in getting the B vitamins absorbed properly by giving you certain over-the-counter or certain prescription, so that you can bring your homocysteine levels down. Certain other medications which can have an effect on absorption. Some medication can interfere with the homocysteine metabolism or deplete B vitamins, including metformin. People who are on metformin, particularly people who are diabetes, diabetic patients, they are prescribed metformin, so that can impede also the absorption of B vitamins. So this kidney dysfunction, the kidneys help clear homocysteine from the blood. If somehow kidney functions are not proper, which you need to have a separate test, of course, your GFR and your yearly blood work, your doctor should keep an eye, and you yourself should keep an eye on your kidney functions, that your kidneys are functioning properly. So if you are not compromised on that front, so make sure that your homocysteine is optimal in that area as well. Lifestyle factors: smoking, excessive alcohol, poor diet, which we have been talking, you have to have a balanced diet, and chronic stress can all contribute to high homocysteine levels. They create oxidative stress and inflammation, both which impair homocysteine breakdown. Now, how to address high homocysteine, as we said that, B vitamins, B6, B9, B12, omega-3 fatty acids, and ensure your vitamin D is between 40 to 60. I mentioned in my various vlogs, I personally prefer around 60 and above because it gives you a protection with a lot of non-communicable diseases. Your probability of those non-communicable diseases goes down quite a bit when you are at 60. But there is another therapeutic level of vitamin D, which is considered from 80 to 100, which will protect you for autoimmune issues, which I had done in separate vlogs. But make sure, I cannot put more emphasis, which I have been doing it all these times, that when you take your D level up, when you take your vitamin D supplement, you need to take vitamin K2, okay? Vitamin K2. A lot of doctors are not talking about it. They have no idea. They sometimes, confuse the vitamin K with K2, totally two different animals. And make sure that, you see my vitamin K2 vlogs because I have covered extensively in this area earlier. So let me stop share here. So this homocysteine is a very crucial biomarker. So I request all of my viewers, take your time, read this newsletter, which I have received recently, because I get all the updated research in my mailbox whenever there is something. And I thought that, I'm going to share this with you. I'm going to include this link in my description, under the description, so that you can, read it at your pace. If you have any questions, concerns, you can include in the comment section, and I will address it in a timely manner. I hope to see you next week with another set of vlog. See you then.